Hmm. So now we are starting the nervous system in abdomen. So here we have to learn the plexus. So here we have plexus. The first is prevertebral plexus, vertebral plexus, and another is lumbar plexus. These are two types of plexuses in abdomen. The, these are nerve supply basically, nerve supply of abdomen. Hmm. So first we are starting the prevertebral plexus, and another one important another plexus is also plexus not nervous system, enteric nervous system, which is especially for GIT. Enteric nervous system. Then these are three types of nerve supply in abdomen. So first we start the prevertebral system. These contains splanchnic nerves. This is for splanchnic nerves. Nerves present here. Splanchnic nerves are what? The nerves which do not interchange basically gray ramus and white ramus in the sympathetic plexus. You can write the nerves which go in sympathetic ganglia, but not relay there. But they do not relay. They just go and come out as it is, not relay there. Just white ramus go and white ramus come out. White ramus communicant. Communicant go and white ramus communicant out from the sympathetic plexus, sympathetic ganglion basically. Go and out. So first, how it is designed. Basically, for this, we take a diagram. Let's say this is a sympathetic ganglia, sympathetic chain. First, we draw the nervous spinal cord. This is the spinal cord, let's say. This is the spinal cord. Then from the spinal cord, we know the ventral horn relay motor impulse. So there come out as white ramus communicant. Then gray. From there, we know a sympathetic chain. This is a sympathetic chain. There are many ganglions present. These are cervical. In cervical region, there are three ganglions: superior, middle, and inferior. Then thoracic. Thoracic में up 11 to 12 ganglion present. Then 10, 11. Then, then in lumbar region there are around four ganglia, and then in sacral region. Then, then in sacral region. So basically these are sacral ganglia. Three to four are in sacral region. These are cervical ganglion. After their nerve come out from the spinal cord. The nerve come out as white ramus communicant. Basically, let's say we draw these connections. These are white ramus, not only one in one. We just draw. This is sympathetic chain. This is sympathetic chain. Sympathetic chain. This is spinal cord. Then from here, then this prevertebral plexus form. It is a plexus around the aorta, ascending aorta, descending. It is a plexus form around descending aorta, prevertebral plexus. The plexus of nerves form around descending aorta. Then, so first how it forms. Let's say this is the aorta. We draw the straight aorta. After this, it divided into two internal branches. Right? So this is aorta. So here the plexus form of splanchnic nerves basically. These nerves do not relay in the spinal sympathetic ganglion, they come out as white ramus communicants and then then go into the prevertebral plexus. These are white ramus communicant. White ramus communicants. Then there are many splenic nerves formed. So first in thoracic region, then in another region. This prevertebral plexus only for abdomen. So here we can take section. Let's say we start here from thorax. This is thorax. This is thorax level. Thorax is this level. This is thorax level. The above are cervical ganglion and these are the thorax ganglion. So from the fifth ganglion, there are splenic nerves formed. Like this. This is fifth, sixth, seventh, eighth, ninth. All these form the one nerve. Let's say this is 1, 2, 3, 4, 5, 6, 7, 8. Right? So these form a plexus called a nerve called splenic nerve, which is again a gray white ramus communicant combination. Then this is called greater splenic nerve. And now here there are many small ganglions present. There are 3 ganglions present here, basically combination of ganglions. So there are 3 types of ganglions. First is this is celiac trunk, you know. So near celiac trunk there is a celiac ganglion. There is celiac ganglion. Then another is, we know, there is superior mesenteric, which is near, and here we have a ganglion present superior hypogastric. Another ganglion articorenal, aortic. This aortic. And then there is another ganglion which is more near, which is called superior hypogastric, and then it continues as the plexus called inferior hypogastric. The this is, so these nerve continue here. This nerve drain into celiac ganglion. Another nerve is 10, 11. This another nerve is this greater splenic nerve. This is lesser splenic nerve, which is drain into the aortic. And another is least splenic nerve, aortic-original and aortic. So, and the third nerve is least splenic nerve, which is origin from the 12th ganglion. It again drain into the this ganglion. So, what are the names of this ganglion? First naming कर लेते हैं. This is celiac ganglion. It has many another ganglion. This is aortico-renal. Aortic ganglion. Aortic ganglion बोलते हैं. Aortic ganglion. And another is this is superior hypogastric. Hypogastric plexus. This is plexus, not only ganglion. This plexus, and this is inferior hypogastric plexus. Inferior hypogastric plexus. These are plexus, not only ganglion. Basically, connections होते हैं many nerves का. These are connected, and these again as below. These go down as below, like this. So these are plexus. Then this whole is inferior hypogastric. Then here it continues as pelvic plexus. Then in lumbar region there are 2 to 4 splenic nerves also which relay into these ganglions. Then in superior hypogastric ganglion, all these. From lumbar region we can draw. This is thoracic. Here we start lumbar. This is lumbar region. Lumbar level. Here many nerves combine and also relay. We draw 2 which relay into the superior hypogastric. We draw it from different color. These 2 again drain into this. These are lumbar splenic nerves. These 3 are thoracic and these are lumbar. Then here is sacral also. Sacral also present. Sacral also there are 3 to 4 present, which again drain into the superior hypogastric and inferior hypogastric. Superior hypogastric basically. But then another nerve comes. The first naming important. Wait. नेमिंग कर लेते हैं. These 3, 1, 2, and 3. This is greater. This is lesser. And this is least. Splenic nerve. All these are splenic. These all are splenic nerves. So we only write names. All are thoracic nerves. Then here, these are lumbar and these are sacral. One important point is this. Here we write all these splenic nerves are sympathetic, because sympathetic chain से निकल रही है, sympathetic nerve, except one which is origin from the sacral region, basically sacral region. Here we draw sacral. Let's say this is S1, S2, S3, S4. This S1, S2, S3, S4, and S5. One is S5. Then these are sacral. So from S2, S3, S4, the nerve comes which are splanchnic, but they are parasympathetic. These again drain into inferior hypogastrium. Wait, red color भी use करते हैं. Done. These are again splanchnic but are parasympathetic. These drain into this. 2 to 3 possible हैं. These are 2 to 3 or 4 also. 4 basically. These are 4 nerves drain to this inferior. So here inferior hypogastrium. This is pelvic plexus. This is pelvic region, pelvic plexus. This is pelvic plexus, which is parasympathetic, and all these are sympathetic. This is parasympathetic, and all these are sympathetic nerves. But what are their roles? They supply the organs of the abdomen. Basically, they supply the organs. These all splenic nerves supply the organs. So this is the prevertebral plexus. This celiac ganglion. This celiac ganglion also contains some another ganglions also. The celiac ganglions connection with the celiac ganglion. How many other ganglions contain in celiac? Ganglia. Then So basically, the ganglions in celiac are first the two celiac ganglion, this small celiac ganglion, small celiac ganglion. One is these are two. One is superior mesenteric ganglion, superior mesenteric ganglion, and what about the aortic ganglion? The aortic ganglion have inferior mesenteric ganglion similar like superior. If superior present, so inferior also present. Inferior mesenteric ganglion. Then another, these are the content. Basically, these superior and inferior hypergastric, not plex. These are plexus, not ganglion. Then so these are the controls. The ganglions present another here. What about the aortic-renal ganglion? The aortic-renal ganglion is formed from this and this. This is the combination of celiac and aortic, celiac and aortic. There are many combinations and permutations formed here of nerves and ganglions. Aortico-renal ganglia. From this and from this. Done? The one important ganglion is celiac ganglion or renal ganglion also present. Renal. Hmm. So another ganglion here is spermatic plexus. Spermatic plexus also connect here. Then so basically this is the whole supply. This is the whole sympathetic supply. This is for sympathetic supply. Remember, this plexus is for sympathetic supply. The spinal cord, sympathetic chain. Then here, this is the prevertebral plexus. Basically, vertebral aorta के सामने है. Just prevertebral plexus, ganglions. One is one, two. These are two plexus. Plexus. These nerves. These are thoracic nerves. These are lumbar nerves. These are sacral, and these are pelvic. These are only nerves which are parasympathetic, and another all are the sympathetic nerves. Then this for sympathetic supply. it supply remember, from the above the body, there is a vagus nerve which contains the parasympathetic supply, but it is only up to the two-thirds of the transverse colon of the right side. After this, the sigmoid colon, rectum, all these have supply of parasympathetic supply from the pelvic region nerves, sacral nerves, basically sacral nerves, which supply the parasympathetic supply. Then from these also supply the stomach. So we can write the stomach supply. Stomach, how is splanchnic nerve supply the stomach? Splanchnic nerve supply of stomach. So first stomach, we know the nerve sympathetic value. Sympathetic value for stomach is around T5 to T12, T6, T5 done. This is from here the nerves come out as white ramus communicants. The white communicants. Then they go into the sympathetic chain. From here, a nerve form called greater splanchnic nerve. Greater splanchnic nerve. From greater splanchnic nerve, it go into the celiac ganglion. Then here, this is all the white ramus communicant. Then grey ramus communicant form. This is the grey ramus communicant. These are grey ramus communicants. Then it go to the stomach. So how sympathetic supply reach to the stomach? Like this. This is the sympathetic supply of the stomach through splanchnic nerve. So all these organs directly or indirectly sympathetic supply relay from this method, basically splanchnic nerve method in abdomen region. Then and parasympathetic supplies, we know all these vagus, anterior and posterior vagus, divided into anterior and posterior vagal trunk. And in below region, in near abdomen, pelvic region, it is these sacral branches, sacral parasympathetic supply. Done. So this is the prevertebral plexus form in the abdomen. This is the prevertebral plexus. So now we come to the enteric plexus, enteric nervous system. Here is the enteric nervous system. It is also called little brain. Little brain because it can work independently like brain, but it takes supply from the higher centers. This is also a nerve plexus. It is a plexus of nerves formed between layers of GIT. Between layers, remember, we know there are two muscularis layers. The one is outer longitudinal and inner circular. The one enteric nervous system plexus formed between these two layers, and one plexus formed between inner circular and inner submucosal layer. Between these two layers, there are two type of enteric nervous system plexus, and the plexus of nerve form in between layers of GIT. So first we draw types. It has two types, divided into two types. One is Auroback and another is Missner's plexus. This is also called submucosal plexus because present between submucosa and circular layer. Mucosal layer, submucosal plexus. Then their role and their position important. So first take a line. First we draw. It is present between outer longitudinal and inner circular layer. Then and another is it is present between inner circular and submucosal layer. Submucosal layer. Then it is present between muscular layers, so it controls the contraction, basically peristalsis movement of the gut. It controls the movement peristalsis of gut. Of gut. It controls the secretions of the glands and gut. The secretion of glands and gut, basically mucosal secretion. Glands. Then, so first, how there it present? How it present? First, we know there are layers. Let's say this is serosa. outer layer, inner. There are two muscular layers. One is longitudinal muscle, outer longitudinal and inner circular. And inner, there is submucosal layer. This submucosal, and innermost is mucosal. These are layer. This is submucosal layer. Sorry, mucosal. These are the layers of the GIT. So these plexus present between layers. How the one plexus present here, which is called Orove plexus, between outer longitudinal and inner circular. This is, and one plexus present here. This is Misner's plexus. फर्स्ट नेमिंग कर लेते हैं. Serosa, outer longitudinal muscle, inner circular muscle. This is submucosal layer. Layer, and this is mucosa. Mucosa. Done. This submucosa. These are two plexus. This is oroback, and this is Misner's. Done. So how it present, how it controls. It can take impulse from the higher center, control, but it can also regulate independently. Done. So this is the enteric nervous system. लिख लेते हैं यहाँ पे. It take supply from higher centers. But can work independently. Done. So this is the enteric nervous system. Now come to the lumbar plexus. So this is the part we have covered. Then prevertebral plexus, splanchnic nerves contribution, sympathetic plexus, enteric nervous system. Now come to the lumbar plexus. This is the nerve supply of the abdomen, whole nerve supply. And this is the basically nerve lumbar region. Remember one, we have read the brachial plexus, which is present in the cervical and thoracic region, C5 to T1. Now it is another plexus, which is lumbar plexus. Lumbar plexus. So how it formed? So first we know that it is also originated from the lumbar region. Lumbar spinal. Let's say this is the L1, L2, L3, L4, and L5. That these are the nerves. So first nerve here is, we draw from yellow. It is a nerve which has root value. It divided into two. We know this nerve very well. This is the ilio. It has two branches: ilio-inguinal nerve and ilio-hypogastric nerve. It is a nerve from this value. Another two nerves here originate from these roots. The one is obturator nerve, and the another nerve which has similar value, which is called femoral nerve. Then first we draw nerve and then naming it. One is which is originate from L1 and L2. This nerve is called genitofemoral nerve. It has branches genital branch and femoral branch. Then the one important another nerve is from L2 and L3. This L2 and 3 we draw in this side, but is these are the bilateral. All these nerves present on both sides, but we draw here. This is L2 L3. This is called lateral cutaneous nerve of thigh. Remember, this is we have drawn in the relations of the cecum. And another is this is the nerve which is called lumbosacral trunk. So these are the nerves. First name it. This is ilio hypogastric nerve. Ilio inguinal nerve. This has root value L1. Then another is the genitofemoral which has root value L1 and L2. This is genital branch and this femoral branch. This is called genitofemoral. Genitofemoral. Genital branch and femoral branch. And femoral branch. Done. Then another this is nerve is called femoral nerve. Femoral branch अलग चीज है and femoral nerve is different. Femoral nerve. And another is this is the obturator nerve. Obturator nerve. These have similar values. You write the values also. L2 to L4, L2 to L4, L2, L3. Done. This is the lumbosacral trunk. Lumbosacral trunk. And this is the lateral cutaneous nerve of thigh. Remember, these nerves both are present in both sides, but we draw this side. Lateral cutaneous nerve of thigh. Then it has value genitofemoral value is L1 L2. This is L1 L2. It has L2 to L3. And the lumbosacral trunk has L4 to L5. These are the values. These are the basically nerves which go into the different area. One important thing is there is a muscle relation in this region. Which muscle? This muscle is called psoas major muscle, which has important relation. Let's say this the here is a muscle. This is called psoas major muscle. This is the psoas major nerve. So it has relations. This this is the psoas major. Psoas major muscle. This muscle has anterior, posterior, anterior, lateral, or medial relations. In medial relation to the psoas major, this is the obturator nerve. In medial relation, we can write medial relation. This is the medial to psoas major. Medial. This all these are lateral, but except one. The one nerve is anterior to the psoas major. Remember, this is the genitofemoral nerve. It is the anterior relation in the psoas major. It is present anteriorly to psoas major. Anterior to psoas major. Psoas major muscle. This These are the relations of lumbar nerves to the in relation to the psoas major muscle. This is the psoas major. Medial nerve is obturator, and these are lateral nerve, except this. Iliohypogastric and ilioinguinal also are in the lateral relations. These are lateral. These are lateral, and this is lateral. This is medial. We can say this is medial also. Then this lateral cuteness nerve. This is also lateral relation to the psoas major. Then these are the nerves. Lumbosacral trunk is going to the lumbar region. We don't define it because it can cross, but we can write this medial also. Then so these are the relations to the psoas major. Anterior is only one, just genitofemoral nerve, and all are in the different relations. Remember, we know that we only discuss the lateral cuteness nerve of thigh. So there are two also, medial and intermediate cuteness nerve of thigh. These are the direct and indirect branches of the genitofemoral nerve. Medial and intermediate. Cutaneous nerves of thigh are branches of genitofemoral. Genitofemoral. Nerve. Then this is the important note. They are directly or indirectly supply the some muscles, and some go into the thighs. Some nerves go into the thigh. Let's say this is the cutaneous nerve. It also go into the thigh behind the inguinal ligament. Some nerves go behind the inguinal ligament into the thighs. Remember, but some in hmm. So some nerves go into the thigh and supply the thigh region, but some nerves are in the pelvic region. Let's say inguinal nerve. We know inguinal nerve passes the inguinal canal. Ilioinguinal nerve is the false content of the inguinal canal. Hypogastric is also in the hypogastric region. Let's say this is the femoral branch. It go into the thigh behind the inguinal ligament. This is also going into the thigh. This also go into the thigh. So some nerves passes behind the inguinal ligament and go into the thigh. So we can write some nerves passes behind inguinal ligament to thigh. So these are the first femoral nerve, lateral cutaneous nerves, nerve of thigh, femoral branch of genitofemoral nerve. Because genital branch go into the genital region, femoral branch of genitofemoral, femoral. Then and we know these are the branches, the ventral rami. This is the all. This is the most common point in the all plexus. These are the plexus of branches, the ventral rami, plexus of nerves formed by branches of ventral rami. Because we know ventral, one is ventral rami and one is the dorsal rami. So these are the ventral rami. This is the common thing in all plexus, cervical, lumbar, brachial, all. This is not much important. Hmm. So first we draw it. How we draw it? Hmm. So first we draw the plexus. Then- So first, let's say this is the inferior margin of the diaphragm. Diaphragm. Let's say it has curvatures, great curvatures present here, and crus of the diaphragm. Then here we know the psoas major muscle present, and here we know the iliacus muscle present. Then so we draw these branches from the above, from the diaphragm. We know the subcostal nerves come. This is the subcostal nerve. Then one nerve is medial to the psoas major. This is called obturator nerve. One nerve it pierces the psoas major and come out as anteriorly. This is called genitofemoral nerve. One nerve is femoral nerve, lateral nerve, and another is iliacus nerve. Iliac in region iliacus region, which is called lateral cutaneous nerve of thigh. Then this is the lateral cutaneous nerve of thigh. And the one important is ilioinguinal and iliohypogastric nerve. So basically, these are the nerves. First, we name it. This is the diaphragm. Then This is the psoas major. This is iliacus muscle. These are muscle. Then these are the nerves. First is name करते हैं. These are subcostal. This is subcostal. This is not a plexus part, but we draw it. Plexus, subcostal nerve. This is ilio hypogastric. Ilioinguinal nerve. Then this is the femoral nerve. And this is the ilia, lateral cutaneous nerve. Cutaneous nerve of thigh. This is the obturator nerve. This is the genitofemoral. It has genital and femoral branch all are. This is the genitofemoral nerve. This is the one-sided. This whole is the side one-sided plexus. We only draw the one side. This only one side. These all same things present this side. This all same things present this side. This is only one-sided. We draw only one side. Then lumbar plexus. Then these are the nerve supply of the abdomen. Then whole things. Prevertebral plexus. Prevertebral plexus is slightly different or confusing. This is the slightly different and confusing. Splenic, because it is a part of the splenic nerve plexus. Here they directly do not drain, directly passes to the sympathetic ganglion and then changes into from white ramus to gray ramus into different ganglions present. Different ganglions present in the prevertebral plexus. This is the prevertebral plexus. Splenic nerve, many thoracic splenic nerves, lumbar, sacral, and pelvic. Pelvic are important because they are parasympathetic and all are sympathetic. Then there are ganglions, celiac ganglion, aortic ganglion, superior hypogastric plexus, inferior hypogastric plexus. Celiac ganglion also contain different small ganglions. Celiac ganglions, aortic-renal ganglion is a combination of these superior mesenteric ganglion. Then in inferior superior, then aortic ganglion may we have inferior mesenteric ganglion and spermatic plexus also connect here. And these are superior and hypogastric plexus are the continuation, basically deep down and passes even below the bifurcation of the aorta. And here this is called the pelvic plexus. In pelvic plexus, drain into the pelvic plexus connect to the parasympathetic splenic nerves. Not drain, splenic. This is the spinal cord, sympathetic chain, all and all. Done. So this whole thing. This is the aortic. Then this is the supply of the stomach. How splenic nerve drain supply the stomach. Another thing is enteric nervous system, which is not much difficult. Orobac and mediastinal plexus. Some orobac present between muscular layers and mediastinal present between circular and submucosal layer. It one transmission control the secretions. Then lumbar plexus has many nerves. It is a plexus of ventral rami and it has relation to the psoas major muscle. These are the nerves basically. Some go behind the inguinal ligament and passes into the thigh. Behind the inguinal ligament and passes into thigh. The femoral nerve, lateral cuteness nerve of thigh, femoral branch of genitofemoral. And this is the how it look like. Some muscles, relations, all these things. It is a piercing point. That so next time we start the kidney. Thank you.